Today we are going to learn about the pharyngeal apparatus. In this session, we are going to learn the introduction, components of pharyngeal apparatus, components and derivatives of pharyngeal arches, components and derivatives of pharyngeal clefts, components and derivatives of pharyngeal pouches, and its clinical correlations. First, the introduction. The pharyngeal arches or the brachial arches. In the Greek word, the brachial means gills. They are a series of externally visible anterior tissues, binds lining under the early brain that gives rise to the structure of the head and neck.
Development of embryonic disc with the establishment of the head fold, part of yolk sac get incorporated into it and forms the foregut. The foregut is bounded ventrally by pericardium and dorsally by the developing brain. Cranially, it is at first separated from the stomatodium by buccopharyngeal membrane. When this membrane breaks down, the foregut opens to exterior through the stomatodium. At this stage, the head is separated by the bulging caused by the developing brain, while the pericardium may be considered as occupying the region of the future thorax. The two are separated by the stomatodium, which is the future mouth. It is thus apparent that the neck is not yet present. The brachial apparatus consists of the brachial or pharyngeal arches, pharyngeal cleft, pharyngeal pouches, and pharyngeal membrane. The pharyngeal or brachial arches. The neck is formed by the elongation of region between the stomatodium and the pericardium. This is achieved partially by descent of developing heart. However, this elongation is due to mainly to the appearance of series of mesodermal thickening in the wall of cranial most part of the foregut, the future pharynx. This mesodermal thickening is called as pharyngeal or brachial arches. The cranial most part of the foregut, that is the pharyngeal part, it is funnel shaped to begin with. It is compressed dorsoventrally and present a ventral wall or floor, dorsal wall or roof, and the two lateral walls. A coronal section through the foregut before the appearance of the pharyngeal arches. At this stage, the endodermal wall of the foregut is separated from the surface ectoderm by a layer of mesoderm. Soon thereafter, the mesoderm comes to be arranged in the form of six cylindrical bars that runs dorsoventrally in the side wall of the foregut in craniocaudal sequence. Each of these bars grows ventrally in the floor of developing pharynx and fuses with the corresponding bars of the opposite side to form a pharyngeal or brachial arch. Each bars, when viewed from the front, is horseshoe shaped. The arches are numbered craniocaudally as 1 to 6. In the interval between any two adjoining arches, the ectoderm extends outwards in the form of a pouch. It is called as endodermal or pharyngeal pouches. To meet the ectoderm, which dips into this interval as the ectodermal cleft. The pharyngeal arches are six curved mesodermal thickening, with each arch having an ectodermal covering and an endodermal lining containing a mesodermal core. These provide the support to the ventral and lateral walls of the primitive pharynx by the time that the anterior neuropore closes. The first and the second pharyngeal arches are present. The first arch is also called as the mandibular arch, and the second it is called as the hyoid arch. The third, fourth, and sixth arch do not have a specific name. The fifth arch disappears soon after its formation, so that only five arches remains. The component of pharyngeal arches. A core of mesoderm derived from the proximal mesoderm and the neural crust, and a cartilage that arises from the neural crust, and a pharyngeal arch arteries that arises from the aortic sacs and the nerves. The structures formed by the mesoderm of each arches are the skeletal elements, striated muscles, arterial arches, and the nerve arches. In the skeletal elements, the cartilaginous part of the bone which is begins from here and which is remains cartilaginous or may develop into bone, and the striated muscles. These muscles is supplied by the nerves of the corresponding arch. Later its development. This musculature may or may not be retained its attachment to the skeletal elements derived from the same arch. In the case of arterial arches, the ventral to the foregut, an artery it is called as the ventral aorta develops. The dorsal to the foregut, another artery called the dorsal aorta. It is formed. A series of arterial arches connects the ventral and the dorsal aortae. Coming to the nerves of the arch, each pharyngeal arch is supplied by the nerve derived from hindbrain. In addition to supplying the skeletal muscles of the arch, it is supplied sensory branches to the overlining ectoderm and the endoderm. In some lower animals, each arch is supplied by two nerves. The nerves of the arch itself runs along the cranial border of the arch. It is called as post-traumatic nerves of the arch. Each nerve also receives a branch from the nerve of the succeeding arch. This runs along the caudal border of the arch and is called the pre-traumatic nerve of the arch. In human embryo, however, a double innervation is to be seen only in the first pharyngeal arch. Next, we are going to learn about the derivatives of pharyngeal arches. First, the nerves of pharyngeal arches. From the first arch, which gives rise the maxillary and the mandibular nerve, and also the cauda tympani nerve. From the second arch, which gives the facial nerve, and from the third arch, which gives the glossopharyngeal nerves, and the fourth arch gives the superior laryngeal, the branch of vagus nerve, and the sixth arch gives a recurrent laryngeal nerve of vagus nerve. The muscular elements of the pharyngeal arch are: from the first arch, the muscles of mastication, that are the temporalis, masseter muscle, medial and lateral pterygoid muscles developed from there, and the anterior belly of digastric, mylohyoid, tensor tympani, and the tensor villi palatini muscles originated from first arch. From the second arch, the muscles of facial expression, the posterior belly of digastric muscles, and the styloid and stapedius muscles developed. From the third arch, the stylopharyngeus muscles developed. From the fourth arch, the cricothyroid, levator palatini, constructors of pharynx, and intrinsic muscles of larynx developed. From the sixth arch, all intrinsic muscles of larynx except the cricothyroid. Next, the skeletal elements. From the first arch is called as the mandibular arch, which has a cartilage, it is called as the Meckel's cartilage. From the first arch, the malleus, ingus, mandible, maxilla, zygomatic, palatine, anterior ligament of malleus, and the spinomandibular ligaments developed. From the second arch or the hyoid arch, which has another cartilage, it is called as Raychard cartilage. From this stepes, styloid process, stylohyoid ligament, lesser cono of hyoid bone, and the upper half of hyoid bone develops. From the third arch, the greater cono of hyoid bone develops, and from the fourth and the sixth arch, which gives thyroid, cricoid, corniculate, cuneiform, arytenoid, thyroid ligament, epiglottis from the mesenchyme of hypobranchial eminence. The overview of derivatives of pharyngeal arches. Next, the arteries developed from first pharyngeal arch, the maxillary artery. From the second, the hyoid and stapedial artery. From the third, the common carotid and internal carotid artery. From the fourth arch, aortic arch on the left side and subclavian artery on the right side. And from the sixth arch, the ductus arteriosus on the left side and the pulmonary artery on right side. The clinical correlation of first arch. It is due to the lack of migration of the neural crest cells into the first pharyngeal arch. It is called as Teacher-Collins syndrome. It is inherited autosomal dominant trait disease. The symptoms are malar hypoplasia, mandibular hypoplasia, down slanting palpebral fissure, and deformed external ear. And another clinical condition, Pyre-Robin syndrome. It is also an autosomal recessive disorder. The symptoms are micrognathia, cleft palate, glossoptosis, that is, the posteriorly placed tongue. Next, the pharyngeal cleft. The fate of the ectodermal pharyngeal cleft. After the formation of the pharyngeal arches, the region of the neck it is marked on the outside by a series of grooves or ectodermal clefts. The dorsal part of the first cleft only persists between the first and second arches and develops into the epithelial lining of external acoustic meatus and cuticular layer of the tympanic membrane. The second arch mesoderm overgrows the succeeding arches and come to overhanging them. The space between the overhanging second arch and the third, fourth, and the sixth arches are called as the cervical sinus. Subsequently, the lower hanging border of the second arch fuses with the tissue caudal to the arches. The side of the neck now becomes smooth. The cavity of the cervical sinus normally get obliterated. Part of its persists and gives rise to the swellings that lies in the neck region along the anterior border of sternocleidomastoid muscle. This is called as brachial cyst. The dorsal part of the first cleft only persists, that develops into the epithelial lining of external acoustic meatus, where the other clefts are obliterated. Derivatives of pharyngeal clefts and pharyngeal membrane. From the first cleft, external auditory meatus and outer ectodermal layer of tympanic membrane developed. The second, third, and fourth clefts are obliterated or disappears. From first pharyngeal membrane, the tympanic membrane develops, and second, third, and fourth are obliterate or disappeared. And next, some clinical conditions. The brachial cyst, a remnant of second, third, fourth pharyngeal clefts form cervical sinus. Normally, the cavities of cervical sinus disappears as neck develops, but it fails to obliterate, become the brachial cyst, which appears along the anterior border of sternocleidomastoid muscle. Another condition, brachial fistula. When the brachial cyst ruptures, the brachial fistula develops, the, which opens along anterior border of sternocleidomastoid muscle. The fistula are two types, internal and external brachial fistula. First, the internal brachial fistula. The cyst opens into the pharynx, usually in the tonsillar region. And another one, the external. If the cyst opens outside, usually anterior to the sternocleidomastoid muscle. Next, the pharyngeal pouches. There are four ectodermal pouches. The derivatives of pouches are divided into ventral and lateral. The ventral derivatives develops in the floor of pharynx and contribute the formation of development of tongue. The lateral derivatives, except that of the first, are divided into those derived from ventral wing and those derived from dorsal wing. From the first pharyngeal pouch, the ventral part is obliterated by the formation of tongue. Its dorsal part receives a contribution from the dorsal part of the second pouch, and these two together form the diverticulum that grows towards the region of the developing ear. This diverticulum it is called as tubotympanic recess. The proximal part of these recess gives rise to the auditory tube, and the distal part expands to form the middle ear cavity, including the tympanic or mastoid antrum. The auditory tube is the communication between the nasopharynx and the middle ear cavity. From the second pharyngeal pouch, the endoderm proliferates to form the solid buds. The central core of these buds breaks down to form the tonsillar crypts. The part of this pouch remains as intertonsillar crypt or crypta magna. The dorsal part take part of the formation of tubotympanic recess. Next, the third pharyngeal pouch. The communication of this pouch with the pharynx gradually narrow and ultimately cut off, and it gives the parathyroid third or the inferior parathyroid gland from the dorsal wing and the thymus from the ventral wing. And from the fourth pouch, the communication of this pouch with the pharynx disappears, and which gives the dorsal wing from the parathyroid 4 or the superior parathyroid gland from the ventral wing may contribute to the thyroid gland. Then the fifth pouch incorporated with the fourth pouch, the caudally, the pharyngeal complex and parafollicular cells or seal cells develops. Next, the derivatives of pouches. From the first pharyngeal pouch, the tympanic cavity, auditory tube, inner surface of eardrum develops. From the second pharyngeal pouch, the palatine tonsil, tonsillar fossa develops. From the third pharyngeal pouch, the thymus, inferior parathyroid gland develops. From the fourth pharyngeal pouch, the superior parathyroid gland and thyroid gland may be develops. From the fifth pharyngeal pouch, ultimobrachial body develops. While concluding this session, we have to know about the pharyngeal arches. They are five in number that present in the lateral wall and the floor of the primitive pharynx. The pharyngeal clefts that are four in number that present externally between the arches and lined by the ectoderm. Then pharyngeal pouches, they are four in number that present internally between the two pharyngeal arches and that is lined by endoderm. And finally, the pharyngeal membrane, they are four in number and that is located between the adjacent arches.